Hello, everybody. My name is Ryan Averett. I'm a licensed clinical social worker and a mental health therapist, and today I wanted to talk about depression and what helps reduce symptoms of depression. Unfortunately, depression is very prevalent in the United States. If we go over to the National Institute of Mental Health's website, we can see that in 2021, there was an estimated 21 million adults in the U.S. that have had at least one major depressive episode. And this represents 8.3% of all U.S. adults, which is basically 1 in 12 people. And also, if we go over to the American Foundation for Suicide Prevention's website, we can see that suicide is the 11th leading cause of death in the U.S. In 2023, 49,000 Americans died by suicide, and there was an estimated 1.5 million suicide attempts. These numbers, to me, are absolutely staggering. And if there's anything we can do to reduce these numbers, then we want to jump on that opportunity. So today, we're talking about depression and how we can start feeling better. We'll talk about what is depression, we'll talk about the causes of depression, and we'll talk about what reduces depression. So what is depression? First of all, depression is not just everyday sadness. Sadness is a normal part of life, it's a normal emotion, and usually whenever we talk about sadness, we talk about it in terms of being an emotion. So in terms of being something that you might feel at a part during the day, or maybe at different points throughout the week. But sadness in and of itself is not a mental health disorder, and it's not necessarily a big problem. Whenever we talk about depression, we're usually talking about mood, so sustained high levels of emotion over a significant period of time. And whenever we talk about depression, at least in terms of diagnosis, that can look like a bunch of different things. It can look like major depressive disorder, persistent depressive disorder, bipolar disorder, which includes depressive episodes. It can look like postpartum depression, and there's a couple others that I did not put here, but there's a whole section of the DSM-5 that talks about depressive disorders. For the purpose of defining what we're going to be talking about with depression, we're going to look at the DSM-5's criteria for a depressive episode in the major depressive disorder diagnosis. So, if we pull up the DSM-5, it defines what a depressive episode is. So it looks like having a depressed mood for most of the day, nearly every day. It looks like a markedly diminished interest or pleasure in almost all activities, a significant weight loss when not dieting or significant weight gain, insomnia or hypersomnia nearly every day, psychomotor agitation or retardation nearly every day, fatigue or loss of energy nearly every day, feelings of worthlessness or excessive or inappropriate guilt, diminished ability to think or concentrate or indecisiveness, and recurrent thoughts of death, recurrent suicidal ideation without a specific plan, or a suicide attempt or a specific plan for committing suicide. This is really what we're talking about whenever we use the word depression, is this set of symptoms right here. Now, what causes depression? There can be many different things. There can be psychological factors like trauma, grief, chronic stress, negative thought patterns. There can be environmental and social factors like poverty, isolation, discrimination, lack of support. There can be medical conditions and medications that contribute to depression, like chronic illness or certain prescriptions. There can also be biological factors like genetics and family history, or imbalances in neurotransmitters and brain chemistry. I'll stop for a second and talk about the biological factors. In my experience, a lot of people who seek out mental health treatment have the idea in their head that if they're depressed, then what's going on in them is that there's a neurochemical imbalance going on in their head. And while that is sometimes true, most of the people that I've worked with don't appear to have any sort of neurochemical imbalance going on, at least as the primary reason for their depression. And many of these people will go on a medication like an SSRI, some sort of antidepressant, and not get significant results. And if that's the case, if the first thing that someone did to treat depression is get on an antidepressant and it's not working very well, then potentially there's all of these other factors that are the main source of their depression. Maybe they have the trauma going on, the grief, poverty, isolation, chronic illness, but in my experience, usually it's one of these things that's causing depression, and rarely is it primarily a neurochemical imbalance going on. We could spend a whole lot more talking about what causes depression, and it's different for everybody. It's going to be a combination of different factors, but overall, whenever we look at depression, we can say that for any given person, the cause of their depression is probably going to be multifactorial, a mix of biological, psychological, and social influences that are contributing to the depression. So what reduces depression? This is the big question. There's many different things. You can get professional treatment, like therapy. You can go to a CBT therapist, an ACT therapist. There's all sorts of different approaches that can be helpful. You can also seek out professional treatment through medication, so antidepressants and mood stabilizers when they're appropriate. These two forms of professional treatment have been shown to be effective, and if you're dealing with significant depression, I would encourage you to seek out some professional treatment. Other things that can reduce depression are lifestyle approaches. So one of the most effective ways to reduce depression is to start exercising and to start moving, and many people don't love to hear that. Maybe we have 5 different major problems in our life, and if somebody says, well, just go exercise, that sounds very dismissive. We have significant evidence that exercise helps over time. So as much as I hate to tell people, go exercise, go get moving, whenever they might have 10 other problems in their life, we know that it works. So if you're feeling depressed, it would help you to get active in some sort of way. We also know that sleep hygiene can have a significant impact on depression. If you're getting horrible sleep every night, you are more likely to feel depressed. So if there's anything we can do to help you get better sleep at night, that's going to improve your chances for feeling less depressed. It's also important to get a balanced diet, and I would only really tell this to people who have a really horrible diet at the time, but if you know that most of what you eat is junk food or really bad food, changing that up, eating some more healthy foods can help you feel less depressed. Another thing that we know significantly helps reduce depression is social connection. So having supportive relationships in your life and being involved in a community, those are very important protective factors against depression. Unfortunately, in my experience working with people who have depression, it's very rarely the case that depressed people have people in their life that they feel very connected with. They might have people in their life that they have relationships with, but oftentimes those relationships feel very surface level, and they don't have many people that they can go to and talk to whenever they're feeling really bad. So if you're depressed, one of the best things that you can do to reduce depression is to have people that you genuinely feel connected with and people that you feel like you can be real with and honest with about your life. There's also a set of coping skills that can be really helpful. So journaling has been shown to reduce depression. Mindfulness meditation has been shown to reduce depression. And relaxation techniques for when people are really depressed have shown to be helpful. I wanted to conclude this video by mentioning a couple different resources. So, if you are in crisis, you can always call or text 988, which is the Suicide and Crisis Lifeline. There's also a specific text line, so you can text HOME to 741-741. Whenever I talk about these resources with clients, one of the most common responses I get is that I don't want to reach out to these people and then have them send someone to my house and put me in the hospital. Very rarely will these people actually do anything like that. Their job is to help and communicate with you. Now, if you tell the person that I'm suicidal and I have this plan and I'm about to execute on this plan, then sure, they're going to call 911 and they're going to get people out to your location. But unless you say those things specifically, their job is to talk to you and to be a listening ear and to help as much as they possibly can. But also, for immediate danger, this is always the best resource, 911. I know that this was another short video, so I appreciate anyone who watched it. The take home here is that if you are depressed, if you are suicidal, please reach out to somebody. The world is absolutely better with you in it, so don't let depression completely rule your life and don't let it take your life. There are people out there that want to help and can help, so please reach out and get that help. That's all I have to say for today's video. Thank you very much for watching. Take care and have a great rest of your day.